Welcome to Westmoreland Community Connections, a look at issues and happenings on Classic Hits 107.1 WHJB. Here now is your host, Chad Amond, President and CEO of the Westmoreland County Chamber of Commerce.
Hello and welcome to Westmoreland Community Connections. I'm your host, President and CEO of the Westmoreland County Chamber of Commerce, Chad Amond. I am delighted to have on the show today Dr. Libby Detschelt. She is a physician with Excela Health Vascular Center and the Excela Health Advanced Vein Center. Dr. Detschelt, thanks for being on the show.
Thanks for having me here this morning, Chad. It's a pleasure. Yes, I am Dr. Libby Detschelt. I am the Director of Vascular Surgery for Excela Health. I am a board-certified surgeon in both general and vascular surgery, and I'm excited to be here today to talk a little bit about what I do.
So how did you get into the vascular and the vein center program, and why did you get into vascular surgery? What prompted you to take on that occupation?
Well, I think that at some point when you are in medical school, you have to make a decision between whether you're going to do medicine or surgery. And on my surgery rotations, you're in the operating room, and it was just an amazing experience. I mean, it's an absolute privilege that people and patients trust you to make an incision on them and rework their insides to save their life, save their leg, do really remarkable things. And vascular surgery in particular is, frankly, a lot about instant gratification. There was no pulse before we started the surgery, and when I'm all done, they have a pulse back.
Wow, yeah. So you're making impact.
Absolutely. It's an instant impact that it's really remarkable, the influence that it can have on people's lives.
So I always say I have no background in biology, chemistry, medicine, and anything like that. And some of the listeners on they're listening to today's program, and they're maybe driving, and they're saying, "Oh man, I don't understand."
No one understands me, Chad.
About this. Yeah, right. So I'm joining that club. And so what is vascular disease, and what are the impacts, and how do you
Absolutely
understand it?
Right. I have a weird job. I have a very weird job, and I think about things all day, every day that most people take for granted. So when we are talking about vascular surgery, what we're talking about is blood flow. And there are two sides to blood flow, right? There is the arterial side. Your heart squeezes and it pumps out the blood that's rich in oxygen and rich in nutrients, and it sends it through the arteries throughout the body. And then in the capillaries, those arteries drain into the veins, and then the veins are that second half of that blood flow system. They take the blood that's now been deprived of the oxygen because it's already delivered it and carries it back to the heart. So both sides are really very important, but they kind of each have their own certain diseases that go with it and the effects that it can have on people. So they kind of have their own symptoms that go with each.
So what are some of those diseases? I mean, bottom line, it's blood flow.
Bottom line, it's blood flow.
Blood flow.
In its simplest form, I am just a plumber.
Okay. Well, hey. When at the chamber, people think we only cut ribbons and host a beer mixers. So, that's a good way to describe a vascular surgeon. You're basically a plumber.
I am basically a plumber. It's all about the flow.
Okay. So, what are some of the issues that patients who's at risk for getting vascular disease, and what can a person do if they have those risk factors?
So the risk factors for the arterial side of disease are different than the risk factors for the venous side of disease.
Okay.
So why don't we start with the venous side?
Okay.
And we'll talk about that for a little bit. Those are the veins.
Okay.
So if we talk about vein disease, then the risk factors for getting vein disease are people who have a family history of having varicose veins. So varicose veins are like those big, bulgy, kind of like ropey or wormy looking things that bulge, usually on people's legs. Another risk factor would be if you have had a history of a DVT or a deep venous thrombosis. Those are like those scary blood clots that they advertise on the airplanes, the ones that can break off and go to your lung. other risk factors for that would be, frankly, like job history. So people who are on their feet a lot. I take care of a lot of factory workers who are on the concrete floors. The other kind of classic examples would be the hairdressers, because they stand all day.
Oh, right.
The postal workers who used to have to walk and deliver their route. All of that puts a kind of constant stress on the veins as they're trying to get the blood up and out of the leg. And then, frankly, one of the other biggest risk factors would be pregnancy, which obviously that only affects women. But anything that puts kind of a lot of extra pressure on your midsection, being overweight would be another example of that. All of it just affects the ability of the veins to carry the blood up and out of the leg.
Right.
So then what happens is that, our body is really beautifully designed. The veins, as they are carrying the blood up and out of the legs, are supposed to just let that blood flow in that one direction, up, because we're usually upright. But that goes against gravity. So those veins are designed that they have one-way valves inside them, so that as your heart pumps and squeezes, it pushes all of the blood forward and up and out of the leg. And then when your heart relaxes to refill itself, instead of having all of that blood come back down towards your foot, those valves catch it and hold it where it is. So it kind of is a very efficient system to get the blood moving up and out of the leg. But for those reasons that we just talked about, pregnancy, being overweight, family history, job history where you're on your legs a lot, those valves can get stressed out. They can kind of get broken and leaky, and now the blood can pool back down towards the feet.
We're talking with Dr. Libby Detschelt. She is a vascular surgeon at Excela Advanced Vein Center. Dr. Detschelt, one of the things that you're seeing all the time, and this is the knucklehead point of view, right? This is me. We're seeing all of these people like that get these standing desks. So
yes,
is that a good thing or a bad thing? You're saying some of the hairdressers and some of the people that are working on the machinists, they're suffering from vascular disease, and so is that a good thing or a bad thing for people?
Honestly, I think it depends on the person, and I think it depends on the actual job description. If you can have a standing desk, but you're not stuck still in one single immobile position all day long, if it's a standing desk where you're coming and you're going and you're moving around, honestly, I think that has a lot of benefits. It makes us move, all right? Any form of exercise is good.
Yeah.
But one of the risk factors for the venous disease is sort of that stuck in one position, I'm not really going anywhere. And that can put a lot of stress on the veins.
Okay. So I think we talked about the artery side.
No, we've been talking about the vein side.
We're talking about the vein side.
We're talking about the vein side.
Okay. But we're going to talk about the our artery side.
We were going to talk about the artery side. The artery side is the side that carries the oxygen-rich blood from the heart and delivers it to everywhere in the body. Now, arteries are different than veins. Arteries can be affected by a disease called atherosclerosis. You might have heard of it called plaque.
Okay.
And some people call it hardening of the arteries. All three of those things mean the exact same thing. When people have high blood pressure, high cholesterol, diabetes, they smoke, or they have a family history, and then, no offense, it happens to men earlier than it happens to women. All of that can contribute to this building up of plaque inside the arteries, this hardening of the arteries. And like I said, I'm just a plumber, so we're really just talking about pipes. If your pipes are gummed up, blood isn't flowing through them particularly well, right? And so that plaque gums up the inside of your arteries and can cause narrowings or even complete blockages in terms of the amount of blood that is getting to, most commonly in my world, the legs. So that has a different set of symptoms than the vein disease. When you don't have enough blood flow, your legs hurt. You try to walk, but your calf muscles kind of get tired or achy or crampy or burning. I mean, everybody describes it a little bit differently. But regardless, however it makes your calf muscle feel, you have to sit down and rest. And then you can go again after you rest for a little bit.
Well, so do you work in collaboration with cardiovascular physicians as well, surgeons, and I mean, whenever
it's confusing because
whenever you talk about the
right, you're pointing to your chest. Here,
right.
He's pointing. So to my listeners, he's pointing to his chest and he's pointing to his heart, and he's absolutely right because a lot of times we talk about having heart attacks because those vessels that feed your heart need to have stents in them, and yes, it's the same disease. It's the same exact thing. Vascular disease, frankly, is terrible. It's a systemic disease, meaning it can affect any artery in your entire body. I don't have a cure for it.
Right.
But we have lots of things that we do to try to control it and prevent it from getting worse. And then in situations where you need it, we have things that we can do to open up those narrowings and those blockages, like stent your heart, stent your legs, do bypass surgeries.
So you put when in your plumbing
right
program.
Yes, in my plumbing program.
You would put stents in legs as well?
I do. I do that a lot.
Oh, yeah.
There's other things that we do too. Here in Westmoreland County, we have a pretty high percentage of people who still smoke. And so when you put a stent into the leg, it's very different than when you put a stent into the heart. The heart feeds itself first. So meaning the heart squeezes, and then the first organ that sees that freshly squeezed blood is the heart. Right? It's the vital organ.
Right.
You can't live without it. So the flow in those arteries is very brisk. By the time the blood makes it down to your legs, the flow is a lot slower. So putting a stent in the leg does not have the same longevity. It's not going to last as long as when we put stents into the heart. But we have other things that we do in the leg in addition to the stents. We can use balloons. Some of those balloons are special because they're coated with a medicine that's supposed to help prevent the plaque from coming back. And then we also have, I call it the Roto-Rooter device. The official name would be an atherectomy.
Okay.
But it kind of drills through or shaves down some of that plaque, so you're actually removing some of the stuff that's coming up the inside of the arteries.
Okay, so that's similar if you had a draining issue with your house and
Correct.
You called Roto-Rooter.
You call the Roto-Rooter.
Okay.
Yep.
All right. You're listening to Westmoreland Community Connections on Classic Hits 107.1 WHJB. We're talking with Dr. Libby Detschelt. She is a vascular surgeon at Excela Health, and we're going to be back right after these messages.
This is Westmoreland Community Connections on Classic Hits 107.1 WHJB. If you have a suggestion for a topic, or if your nonprofit organization would like to be featured on this program, call us during regular business hours at 724-216-1200.
Welcome back. You're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. I'm your host, Chad Amond, president of the Westmoreland County Chamber of Commerce. Our guest today is Dr. Libby Detschelt. She is a vascular surgeon at Excela Health. Libby, when we at the first segment, we were getting into all of the, well, not all of the things of vascular surgery.
No, we touched on a few.
We touched on it, and basically it's about blood flow, right?
Right.
If the listeners are, they don't understand like me about vascular,
right?
And it's basically about the blood flow and the clots and all of those things.
It is basically about blood flow. So whether we are talking about the artery side, where you can get hardening and plaque buildup, which can limit the amount of blood flow to the body, or if we're talking about the vein side, where the valves, which are important for keeping the blood flowing in that one direction back towards the heart, get leaky, it is all about flow.
So we are going to get into the Excela Advanced Vein Center and,
right.
and talk about that. But I think that the first question is who's at risk for getting vascular disease, and what can a person do if they have those risk factors? So
the risk factors for vascular disease, again, depend on whether we're talking about the arteries or the veins. For the arteries, that's the hardening of the arteries. The risk factors are high blood pressure, high cholesterol, family history, smoking, diabetes, and it does happen a little bit earlier in men than it does in women. For the vein side, the risk factors are different. Those risk factors are pregnancy, being overweight, a family history of varicose veins, having a job where you're on your feet a lot, or having a history of a blood clot in one of the veins in your legs. And what do you do about it? You come see me. I'll take care of it.
Okay.
I will take care of you. For the artery side, there are some really good medical managements for those risk factors. Make sure you control your blood pressure. Make sure you're watching your sugars if you're diabetic, and keep your hemoglobin A1C low. Please consider quitting smoking. I know that it's hard, but it really will make a tremendous difference. And then watch your cholesterol. Make sure that you're on medicine for that. Taking a baby aspirin a day for people who have these risk factors is tremendously important and improves lifespan, decreases risk of heart attacks and strokes.
Describe a baby aspirin. That's like the
81 milligrams.
I was thinking
81 milligrams a day, over the counter.
All right.
Yep.
Okay.
Super cheap.
Okay.
Yep. Totally worth it.
So how do you screen for vascular disease?
Okay, so if we're talking about screening for the arterial side, number one, it's physical exam. Can I feel your pulses, right? Take off your shoes and your socks. Let me see your feet. There are some tests that we can do in the office. One is called a PVR and an ABI. We put blood pressure cuffs in about 4 places down the legs: thigh, just below the knee, ankle, and then around the top of your foot. And we inflate that cuff gently. And we get a waveform. And then we also kind of compare the blood pressure in your arm to the blood pressure at your ankle. That's a really good way to screen for the arterial disease. To screen for the venous disease, it's not so much a screening, it's more of a physical exam. Look at the leg. There are some pretty classic things that I can see. Do you have those big, ropey, wormy, varicose veins on your legs that I can see? Do you are getting some of the discoloration? Because that can be part of venous disease too. And in a really worst case, some people can get what we call venous stasis ulcers. So it's a wound by the ankle that's been there forever and is not healing up.
If there's a listener out there, what would be the primary thing that you said, oh, you need to come see me? I mean, is there something that, like, oh man, my legs are hurting, or the thing on the foot, or
right,
something like that? What would be the, if there's a listener out there and saying, oh man, I need to go doctor.
If you have a wound on your foot that has been there for longer than 3 weeks and isn't getting better, you need to be seen by a vascular surgeon. If you have a toe that has turned blue or black, please don't wait. Please just come in. I will see you right away. If you have pain in your feet that is waking you up at night and keeping you from sleeping and is making you try to dangle that foot over the side of the bed because that makes it feel better, all of those are symptoms of what I would technically call critical limb ischemia. There is so little blood flow to the foot that we are now in a situation where you're at risk of losing the leg if we don't make the blood flow better. On the venous side, if you are someone who struggles with constant leg swelling and wounds that keep coming back, again, that can be a sign of bad venous disease that you would need to see a vascular surgeon for.
So if there's a listener out there and they say, "Oh I need to go to see Dr. Detschelt," how do they connect with you?
They can call the office. Our office phone number is 724-261-5556. They can also go through the Excela Health call center if they wanted to do that, and that phone number is 1-877-771-1234. Either of those ways will get you in to see me. You, to the best of my knowledge, do not need a referral to come in. I see everybody who's worried about it. Our office policy is to try to get people in within 72 hours, or at least offer you an appointment within 72 hours, because some of these symptoms are pretty serious and need to be addressed right away. I have a great team in the office. It's myself, Dr. Justin Wallace. He is my partner, and he is another board-certified vascular surgeon. Jared Smith is my certified nurse practitioner. He is my right-hand man. And Michaeline Auth is our certified physician assistant. Between her and Jared, they keep the service line running, and they are phenomenal.
Right. Let's dig into to the Vein Center a little bit more.
Absolutely.
What does the Vein Center do?
I am really proud of our accomplishment of this vein center. We are one of only 7 other accredited facilities in the state of Pennsylvania. So we have an IAC accredited vein center. That's the Intersocietal Accreditation Commission, who specifically looks at quality medical care, not only in vein centers, but in other different aspects of the medical field as well. So what we do at the vein center is really dig into what is the cause of a person's venous disease, what modalities are they using, what other modalities can they use to try to control their symptoms, and then if necessary, offer procedures that can really improve the quality of people's lives and try to help heal up some of those venous wounds.
That is very impressive. That Excela is only one of 7 accredited programs in the Commonwealth of Pennsylvania.
Right.
That's
even with the big centers downtown.
Yeah.
We are one of only 7 in the entire state.
Wow.
Yep.
Well, fist bump.
Thank you.
That's great.
Yes, we worked very hard on that.
And why is accreditation important? I mean, obviously,
So
you're at the top of the scale.
Correct. So why is accreditation important for the vein center? I think that when you look at the treatment of venous disease, right, if you did a deep dive into what's been going on in the country over the past 10 years, there has been a massive explosion of these quote unquote vein centers across the nation who are all, putting up billboards and offering, vein procedures. They are not always focused on delivery of high quality care. And so here's the reality. Vein disease is lifestyle limiting. It can affect the quality of your life. It can be a real drag, literally, because you feel like you're dragging your leg around. But it's not life-threatening. Nobody's ever lost a leg over it. And so I think the focus needs to be on making sure we are doing things that are medically appropriate and not just because I can inject a vein and bill for it.
Well, you're listening to Westmoreland Community Connections on Hometown Classic Hits 107.1 WHJB. I'm your host, Chad Amond, president of the Westmoreland County Chamber of Commerce. Our guest today is Dr. Libby Detschelt. She is a vascular surgeon with Excela Health. Dr. Detschelt, why did you get into this and specialize in this field?
Well, I think as I was going through my general surgery training, you touch on all different aspects of surgery. And what was unique about vascular surgery was it was not cancer. So a lot of other surgical fields, colon cancer, breast cancer, liver cancer, cancer depresses me.
Oh, yeah.
So I had also gone through a personal experience where she would have been my mother-in-law had she lived. She had just died of ovarian cancer. So I couldn't relive that every single day. So that made vascular unique in that it was not cancer. What I also liked about it, frankly, was sort of the physical aspect of it. Sometimes I can sit down and operate, which is sort of nice. It's small, it's delicate, it's little. I can do it. I'm not a particularly large person, so it seemed to be a good fit.
Well, if a listener wants to connect with Dr. Libby Detschelt, you can call the office at 724-261-5556. That's 724-261-5556. Or you can go on to Excela's website and make sure that you're making the connection. Dr. Detschelt, we're wrapping up the show. What do you see over the next 5 or 10 years? There's so much automation and all of these things. Do you see that there's going to be a vascular disease or the arteries in the veins are going to be solved over the next 5 or 10 years or maybe the next 20 years?
I don't think that it's going to be solved over the next 5 or 10 years. Certainly the technology has changed dramatically even since I started my training. We haven't really talked about aneurysm disease, but aneurysm disease is another thing that affects arteries. If you have an aneurysm of your aorta, it used to be that to fix that, you had a huge incision down the middle of your belly. You were in the hospital for a week. It took 2 months for you to feel like yourself again, and we had to sew in a new plastic aorta for you. Now I can do the same thing by making 2 little needle sticks, one over each femoral artery by your hips. There's no real incision, and I have completely fixed that aneurysm and you go home the next day. So I don't know that we're going to completely solve it, but the technology is phenomenal, and every year it's getting better.
So any last comments for the listeners?
If you are worried about your legs, if your legs are swollen, if they're discolored, if you are having trouble walking because the muscles in your legs are starting to ache after you walk a distance, or certainly if you have pain in your toes or in that front half of your foot that's keeping you awake at night, if you have a wound, a scrape, a boo-boo, anything on your foot that's not getting better, certainly if there is a toe that is black or blue, please consider coming in to see a vascular surgeon. Those are all signs of pretty serious problems that need to be addressed.
Very good. Thank you very much, Dr. Libby Detschelt, for the Excela Advanced Vein Center arterial disease specialist and one of the only 7 accredited programs in Pennsylvania for Excela Health. Thank you very much for being on the show.
Thanks for having me, Chad. It's been a pleasure.
You have been listening to Westmoreland County Community Connections on Hometown Classic Hits 107.1 WHJB. Join us next week, same time, same place, for another edition of Westmoreland Community Connections. Thanks for listening, everyone.
This has been Westmoreland Community Connections, a look at issues and happenings in and around Westmoreland County. Join us again next week on Classic Hits 107.1 WHJB.